Welcome back. A growing number of Americans say they feel alone, especially young Americans. This week is Loneliness Awareness Week, and many of us may not realize the feeling of social isolation deeply impact people around us. In 2020, 79% of adults under age 30 say they are lonely. Young adults are twice as likely to feel lonely as other adults. Now, across all ages, 17% of U.S. adults say they felt loneliness a lot of the day. This means 44 million Americans, 1 in 10 of our friends, neighbors, coworkers, feel so lonely. Now, for one family, loneliness isn't just a feeling. Cindy and Ann Jordan lost their teenage daughter to loneliness. While addiction might have been labeled the cause, it was deeply rooted in her core struggle, chronic loneliness. Chronic loneliness is a silent killer, but not for long. It is such a serious problem that the Surgeon General just declared loneliness a public health crisis, with effects that can be as harmful to our health as, get this, smoking a pack a day. And after losing their daughter, Cindy and Ann Jordan made it their life's mission to help others, and together they funded Picks Health to help people fight loneliness. So Cindy joins us today. We appreciate you being here to talk about this. Thanks so much.
Oh, thanks for having me. I really appreciate it.
Absolutely. So loneliness, as we just said, has been declared a public health crisis. What can people do to not feel so lonely, to prevent it before it gets to that point?
Yeah, I mean, you kind of hit on it. There's degrees of loneliness. So if you're feeling lonely, but you think that if you reached out and if you engaged with your friends, maybe picked up the phone, called someone, that would make you feel better, then that means you're on like one of the lesser degrees of loneliness. And that's exactly what you need to do. You re-engage with community, with the people around you who love you. And sometimes it's hard to take that initial step, but once you do, it will have a big impact on that feeling of loneliness. But if you're kind of in the mid to chronic stage, like Riley was, engaging with your family and friends isn't going to work. You have to take it to the next level. You've got to get engaged in some kind of therapy program or a peer support program like Picks is. You can call your health insurance company, you can call your doctor and say, hey, I am feeling so lonely that I don't think my family understands and can help me. What can I do?
I want to take a deeper dive into that. So how do we know the difference between, those normal feelings of loneliness that affects so many of us and it actually being something much more serious? How do we know the difference?
Yeah, since the pandemic, there's obviously been a lot of research here, but the way you know the difference is the brain actually starts to rewire when you're in a state of chronic loneliness for a period of time. And you start to believe that no one can help you. Not your family, not your doctor, not your medicine, no one. It's hopeless. In other words, you feel alone in your plight. I always say that that's how Riley felt. She just really believed that even though she had a loving family around her, no one could help. That's when you know it's severe. That's when you understand, wait a second, I actually need some kind of, therapeutic intervention here, because there's no way to move through that on your own. I call it stuck in mud. You literally can't get yourself out.
You mentioned her name a minute ago, Riley. So how does her life inspire you and the work that you do?
Well, I mean, clearly, this means so much to me and my family. We firmly believe that this was, like you said, at the root cause of what ended up killing her. But if every day, our organization makes a few thousand phone calls a day, every day I know that we are stopping someone from feeling the way Riley did and stopping at least one family from having to go through what we've been through. So, what more of a motivator do you need to get up every day?
Absolutely. We only have about 30 seconds, so very quickly. This last week, you launched the first ever National Loneliness Helpline. Is this helpline needed permanently, and what's been the response?
Yeah, I really do. I mean, the response has been profound. Lots and lots and lots of young folks in the middle of the night from 12 to 5 a.m. We are currently out there seeking some kind of funding to keep this going. Because not everyone needs to go straight to crisis. Sometimes they just need someone to listen, a companion.
Cindy Jordan, thank you so much for talking about this very personal but serious issue. We appreciate it. Thank you.
Thank you. Have a great day.
You too.